Okay, Assalamu alaikum. So we will discuss about the talk article regarding the postpartum voiding dysfunction. Okay, so what are the key content? The postpartum bladder is vulnerable to the urinary retention, and if there we undetected, then it can lead to the bladder underactivity, recurrent UTI, and the incontinence. Okay, so we already know that is the postpartum bladder care is very important. If we are not detect, then it can lead to the recurrent UTI and the incontinence and the bladder underactivity. So the basically the aim of the interpartum bladder care is to prevent the bladder over distension. So we will care that the patient must be pass the urine within the 6 hours of the delivery. Okay, so let's see. Okay, introduction. So when we will call the postpartum voiding dysfunction, it is defined to is the failure to pass the urine spontaneously within the 6 hours of the delivery or the catheter removal. ठीक है, तो मतलब हम कब बोलेंगे कि postpartum voiding dysfunction है, जब patient within 6 hour हमने catheter पास कर लिया या डिलीवरी उसकी नॉर्मल हुई है, ठीक है, उसके बाद 6 घंटे हो गए हैं, उसने यूरिन पास नहीं किया, तो फिर इस कंडीशन में हम postpartum voiding dysfunction कहेंगे. Okay, so it occur mostly 0.7 to 4%. Okay, so you all remember this percentage. We all know that the postpartum bladder has a tendency to be the underactive and is therefore to the vulnerable to the retention of the urine following the trauma of the bladder and the pelvic floor muscles and the nerve during the delivery. If there is the postpartum voiding dysfunction is unrecognized, we already read this, that it can lead to the prolonged voiding dysfunctions and the recurrent UTI and the incontinence. Okay, so what are the abnormal voiding parameter? The abnormal voiding parameter, when there is the flow rate is less than the 10 ml, and when the volume that she voided it is more than the 150 ml, and when the residual urine volume is more than the 100 ml. So it is all called the abnormal voiding parameter. What are the risk factor for the perpural voiding dysfunction? It is most common in the patient which is the primary in the instrumental delivery, epidural analgesia, prolonged labor, and the perineal trauma. So these are the risk factor for the voiding dysfunction. Okay. Okay, so here is the chart is the most important in this guideline. Okay, we read it. When the patient is not void within the 6 hour, okay, so what will you do? Either you will do the ultrasound or you will insert the catheter and measure the volume. In both cases you will measure the volume. Okay, so if the volume is less than the 500 ml, then what will you do next? Then you will measure the next voided volume and post residual volume. Okay, so when the post residual volume is less than the 150 ml, then there is a no further treatment, and unless the patient is symptomatic. But if the patient is unable to void and you measure her post vital residual volume, it is a more than 150 ml, then you will put the catheter for at least 24 hours. Okay, you will insert the catheter or measure the bladder volume. Then if it is a more than the 500 ml, then what will you do? Then you will insert the catheter for at least 24 hours. What will you do after the 24 hour? After the 24 hour, you will reassess the patient and then you will measure the post residual volume. Okay, so if it is a more than 150 ml, then you will catheterize the patient for at least 1 week. Okay, then you will call the patient for the follow-up after the 1 week. After the 1 week, when the patient is come, then what will you do? Then you will reassess the patient. If there is a persistent problem of the voiding, then you will intermittent catheterization has been done, and then you will refer the patient to the urogynecological opinion. Okay, so all the BCQs are from this chart, so you must remember this chart by heart. Okay, conclusion पढ़ते हैं. So, the postpartum voiding dysfunction is a recognized complications in the puerperam. It is the most common in the instrumental delivery, epidural analgesia, anesthesia, and the perineal tear. That is the recognized risk factor for the development of the urinary retention. To reduce the morbidity and the resulting from this condition, the bladder emptying is must documented in all women with the labor and within the 6 hours following the delivery, and catheter removal. Inability to void must be treated urgent with the catheterization until the resolutions of the symptoms and the adequate bladder emptying has occurred. The flow chart we already discussed that shows the one of the possible guideline for the management of the postpartum voiding dysfunction. Some unit advocate the use of the suprapubic catheter or the self-catheterization. The important issue is that the way every unit has the guideline for the bladder care and the management of the postpartum voiding dysfunction. That is because it is the most common in the postpartum. So that's all about this talk article. I hope you will all understand it.